Today we're diving deep into a common diagnostic dilemma that we often face in the clinic, differentiating between lumbar disc herniation and hip injuries. Differentiating lumbar disc herniation from hip injuries can be clinically challenging due to overlapping pain patterns, shared functional impairments, and limitations in imaging correlation. Here's a breakdown of the main challenges. So, stick around as we break down these challenges, discuss some key diagnostic tips, and help you accurately differentiate between these two conditions. Let's jump right in. One of the biggest challenges in differentiating lumbar disc herniation from hip injuries is the overlapping pain referral zones. You see, the lower back and hip are anatomically close, and their nerve supply overlaps significantly. For instance, a lumbar disc herniation, especially at the L4, L5, or L5S1 level, can refer pain to the buttock, lateral thigh, and even down the leg, a pattern that often mimics sciatica. Meanwhile, hip joint pathology like a labral tear or osteoarthritis can refer pain to the groin, anterior thigh, buttock, or even the knee. Both lumbar disc herniations and hip injuries can throw a wrench in your daily activities, often leading to similar functional limitations. Think about it. Both conditions can make walking a pain, literally. Sitting for prolonged periods can be uncomfortable, and even simple movements like standing up from a chair or bending over can become a struggle. However, there are some subtle clues that can help us differentiate between the two. Hip injuries, for example, often cause pain with weight-bearing activities or rotational movements of the hip joint. On the other hand, lumbar disc herniations tend to worsen with prolonged sitting, flexion of the spine, bending forward, or activities that increase intra-abdominal pressure like coughing or sneezing. Now let's talk about orthopedic tests, those physical maneuvers we use to help pinpoint the source of your pain. While helpful, even these tests can sometimes throw us a curveball. For example, the straight leg raise test, a classic indicator of sciatic nerve irritation, can be positive in both lumbar disc herniation and hamstring tightness, which might develop as a result of altered gait mechanics due to hip pain. Similarly, Faber and Fadir tests, which assess for hip joint pathology, may also provoke symptoms in someone with a lumbar disc herniation due to pelvic stabilization or nerve stretch. And to make things even trickier, the Trendelenburg sign, which indicates weakness in the hip abductor muscles, can also be present in cases of lumbar nerve root compression, particularly involving the L5 nerve root. We live in a world of high-tech